President of the Public Workers Union, Daisy Hazard, says the government's failure to engage the union in discussions on the statutorisation of hospital service in Grenada has left them unable to provide information or comments on the matter. During the delivery of the 2025-2026 throne speech last Friday, Governor-General Her Excellency Dame Cecile Grenada urged trade unions to actively participate in consultations on the process, noting that it is in the best interest of workers. However, Hazard questioned how the unions could participate when government has not responded to any of their letters seeking clarity on the issue.
The government, unfortunately and regrettably, has not seen fit to include the union on matters relating to the proposed statutorization of the hospital, has not shared information with the union, has not invited the union to meetings. We have written, literally, to all concerned parties regarding this same matter, and we await response. However, the union is pellucidly clear of our rights and our responsibilities as the agent, the bargaining agent for workers of all categories at the General Hospital.
The union leaders stressed that the lack of regularization of staff and the uncertainty surrounding workers' status continue to fuel human resource challenges within the health sector.
So what we can say to the media and to Grenada is that health and hospital services in Grenada is fragile and vulnerable, and continues to be even more fragile and vulnerable through the non-action of government and through the actions of government. Workers are not secure, and so our nurses continue to dribble away. As we speak right now, the union is aware of 3 or 4 persons who are preparing to leave within the next month or two.
Hazard further reminded government that this is not the first attempt to place Grenada's hospital services under a statutory body, adding that transparency is key as the process unfolds.
There is a little saying that says, those who do not know their history are doomed to repeat it. But it seems as if those who do know their history might be willing to take a chance on repeating it, because the union will stand firm and articulate its rights as it concerns its members, where any change to their employment has to happen. And so the union calls upon the government to be transparent and to do the correct thing, because statutorization is not a government thing if it's going to happen. It affects and concerns workers, and workers have a union which represents them.
Government has already approved the establishment of a statutorization transition team, which became operational in April 2025. The team is responsible for implementing the Hospital Authority Act under the revised laws of Grenada and overseeing the transition of the General Hospital, Princess Alice Hospital, and Princess Royal Hospital from the Ministry of Health to the newly established Grenada Hospitals Authority within 12 months. Rena Pierre Thomas, GBN News.